how do we manage this? Well, fibromyalgia is considered incurable. Many of us manage symptoms effectively through a combination of approaches. Some people prefer to take medication, pain relievers, just depending on what your experience is. If it's intolerable, the pain is too severe, then some people find relief with medication such as antidepressants, which act like as a muscle relaxants, or nerve modulating medication, which can also help. Physical activity, though tricky, is vital, such as like gentle walking, swimming, and stretching. Cognitive behavior therapy can also teach us on how to manage perception and emotional struggles. I found cognitive behavior therapy very useful. It helped me to engage in a group and to be challenged by the psychologist who was leading the group. I was not happy sometimes, but looking back, it was worth it because he touched on pain points and challenged me to explore, to challenge myself, even though I was in severe pain, and just think of what is the worst that can happen by not attempting to try some of the things that they were teaching us. Some of the things I thought were too babyish in terms of pacing and slowing down, writing diaries of like things that we had to remember and planning out the day. I felt as though it was too basic, running before I could walk. And literally, I could not walk. I was struggling. So there was a purpose and a reason for them to recommend this, so that we could learn how to pace ourselves in order to get to where we needed to in a healthier way, rather than burning and crashing all of the time. Lifestyle changes help too. It also helps to change a lifestyle from a fast-paced to a slower lifestyle. It's not easy. It can be very challenging. And for most of us, it affects our professional lifestyle, as in some places it's very difficult, and understandably so, because a business is a business. Some businesses are unable to make reasonable adjustments to the extent of what Fibro warriors go through. In my experience, they attempted to make reasonable adjustments, but it was just that my symptoms were unpredictable, uncontrollable at the time. There's still issues that I experience today that an ordinary work model wouldn't work for me. So it's just finding an environment that suits your work lifestyle. That can take some time to find something suitable in terms of the environment, whether it be home or in an external environment. Other lifestyle changes, for instance, better sleep, stress management, anti-inflammatory diets, and going through detoxification processes. Some of these processes that I'm sharing with you that require some assistance and support from professionals or people who are very familiar with how to support you in a positive, constructive way, as it is challenging for somebody who's going through a chronic illness with unpredictable and uncontrollable symptoms to maintain a routine consistently, because of the crash and burn processes, because of the daily struggles. It's usually better to have somebody who can then assist. Then let me go on to challenges warriors face.